All right, folks, we're almost done with this chapter. We got 16.5 to 16.7 here. What we're going to talk about is the synapses, and that's the neurotransmitters and receptors of the autonomic nervous system. So you've already seen this. Let me just introduce you to the nomenclature again. The neurotransmitters that are composed of epinephrine and norepinephrine are called adrenergic neurotransmitters, and the receptors that receive the the uh, the norepinephrine and epinephrine are called adrenergic receptors, and you can see that here. And we did already talk about this. However, acetylcholine we haven't talked much about yet. And some of these neurons of the autonomic nervous system secrete acetylcholine. And acetylcholine is a cholinergic neurotransmitter, and the receptors that receive the acetylcholine are cholinergic receptors. Unlike the adrenergic receptors that come in alpha and beta, and then the subtypes alpha 1, alpha 2, beta 1, beta 2, unlike that, there's two types of cholinergic receptors. There's nicotinic and there's muscarinic. The nicotinic receptors are named because they bind nicotine, and the muscarinic receptors are named muscarinic because they bind muscarine, this chemical made by a fungus. Now, remember the words ionotropic? And that means that when the neurotransmitter binds the receptor, it directly opens ion channels, versus the word metabotropic, which is what all of the adrenergic receptors are. They're metabotropic. And that means they go through a second messenger like cyclic AMP, and they might indirectly open an ion channel, but they have to go through this quite often a G protein mediated initiation of a second messenger. All right, so the nicotinic receptors are ionotropic. They open ion channels directly. But the muscarinic receptors are metabotropic, and they go through an enzyme activation that changes the membrane permeability. So that's the cholinergic receptors. All right, now where is everything released? Well, as it turns out, these preganglionic neurons, no matter what division you're in, the preganglionic neurons all secrete acetylcholine. So there's acetylcholine secreted right here, and there's acetylcholine secreted right here, which means the postganglionic neurons have acetylcholine receptors. There has to be acetylcholine receptors right here. There has to be acetylcholine receptors right here. There has to be acetylcholine receptors right here. So the question is, well, what kind of acetylcholine receptors are right there? And the answer is they are nicotinic. Nicotinic. So they're nicotinic receptors. The postganglionic neurons contain nicotinic receptors on them because the preganglionic neurons, whether you're sympathetic or parasympathetic, secrete acetylcholine. And the postganglionic neurons contain nicotinic receptors to receive this acetylcholine. All right, now, that's the same with sympathetic and parasympathetic. Where does it differ? Well, where it differs is the postganglionic fibers. The postganglionic fibers of the sympathetic division are adrenergic. They're secreting epinephrine or norepinephrine. That's what they're secreting. And therefore, the target cells of the sympathetic division must have adrenergic receptors, and that's the alpha and the beta receptors that will receive the epinephrine or norepinephrine. Conversely, over here in the parasympathetic division, what does the postganglionic neuron secrete? And the answer is it secretes acetylcholine. But the receptors are muscarinic. Okay, so there's another way of looking at this. The parasympathetic division secretes acetylcholine, period. The preganglionic neuron secretes acetylcholine, and the postganglionic neuron secretes acetylcholine. But the preganglionic neuron of the parasympathetic division secretes acetylcholine, which binds nicotinic receptors, and the postganglionic neuron of the parasympathetic division secretes acetylcholine that binds muscarinic receptors. Conversely, in the sympathetic division, the preganglionic neuron secretes acetylcholine that binds nicotinic receptors, but the postganglionic neuron secretes epinephrine or norepinephrine, which binds alpha or beta receptors. Now, this right here is showing you the adrenomedullary pathway. It's not saying it, but I'm telling you it is, because remember, in the adrenomedullary pathway, the preganglionic neuron went all the way down to the adrenal medulla, and we said the adrenal medulla was these modified postganglionic neurons. Well, this postganglionic neuron, in this case the modified postganglionic neuron, is dumping its contents directly into the bloodstream. That makes it endocrine, and that's the adrenal medulla. All right, so that's the innervation. That's the synapses and the neurotransmitters and the receptors that receive those neurotransmitters. And you can go back here, and we've already talked about this quite a bit. We said that the ones, that means the alpha 1 and the beta 1, were primarily excitatory. And we said that the 2s, that means the alpha 2 and the beta 2, were primarily inhibitory. That's what we said there. So you could come back here and you can see that with the adrenergics, it depends on what the epinephrine and norepinephrine is going to bind. Because if it binds alpha 1 or beta 1, it's going to be primarily excitatory. But if it binds the alpha 2 or the beta 2, it's going to be primarily inhibitory. All right, so that's the synapses and the that's the synapses, the neurotransmitters, and the receptors. Now, this is really a lot of anatomy that we've studied already, so I'm not going to spend a ton of time on all these plexuses and ganglia here. You can see the anatomy. You can see the sympathetic chain ganglia here, and you can see this plexus right here. You could just see the plexuses all over. I'm not going to spend a lot of time on it. This is really anatomy, and we did some of these. We certainly did. We did some of these in lab. You can see more of them. I have a collage here for you. This looks like the collage. All right, so those are the plexuses and the ganglia. All right. This compares the sympathetic and parasympathetic nervous system, and we've already talked about quite a bit of these, but let's look at it again. First of all, look at the sympathetic is thoracolumbar. The parasympathetic is cranial sacral. So thoracolumbar, cranial sacral. The sympathetic, where are the ganglia? Typically speaking, it's the sympathetic chain ganglia, so near the vertebral column. Where are the ganglia in the parasympathetic? Many of them are intramural, and remember what that means. It means that it's right in the capsule of the effector gland or organ. What are the lengths of the preganglionic fibers? Sympathetically, they're relatively short, but the postganglionic fibers are relatively long. Parasympathetically, the preganglionic fibers are relatively long, but because the intramural ganglia are right in the effector gland or organ, the postganglionic fibers are relatively short. Now, are there any exceptions? Yeah, you bet there's exceptions. Remember the adrenomedullary pathway of the sympathetic division. That preganglionic fiber is really long, but this is a rule of thumb here. What's the neurotransmitter release from preganglionic fibers sympathetically? Acetylcholine. What does it bind? Nicotinic receptors. What's the neurotransmitter release from preganglionic fibers parasympathetically? Acetylcholine. What does it bind? Nicotinic receptors. What is the neurotransmitter release from the postganglionic fibers sympathetically? It is norepinephrine. Now, I'm going to show you a case where acetylcholine is actually secreted. Sometimes it's nitric oxide, but it's normally norepinephrine. What's the neurotransmitter release from the postganglionic fibers parasympathetically? Acetylcholine. Who does it bind? Muscarinic. All right. That's about it. Oh, this is actually pretty important. Because of these varicosities, I said that the sympathetic division was more generalized. I said that you didn't really have a real discrete synapse. You just kind of bathe the effector gland with these neurotransmitters, so you're more generalized. And then I said the parasympathetic because the ganglion was intramural, right in the capsule, and you had a discrete synapse. I said the parasympathetic was more specialized, and I don't mean I guess I don't know if specialized is the right word. It's more focused. Like the synapse will be on one particular cell, where I don't know if generalized is the right word over here. It's more diffuse or dispersed. So this is diffuse or dispersed. Well, there's another thing that makes this more diffuse and this more focused, and that's this degree of divergence. This is how many postganglionic fibers do you get from one preganglionic fiber? That's what we're talking about. And the degree of divergence sympathetically is 1 to 32. So one preganglionic fiber with all these collaterals will diverge into 32 postganglionic fibers. I can't draw them all. But the degree of divergence of the sympathetic division is 1 to 32. So one preganglionic fiber is going to diverge and innervate 32 postganglionic fibers, which go to 32 different places, which release their neurotransmitters from varicosities and bathe their effector glands. So that also adds to the diffuse nature of the sympathetic division. But the parasympathetic division is more focused, and its degree of divergence is only 1 to 6. So one preganglionic fiber only diverges into 6 postganglionic fibers. So that's another big difference between the sympathetic and parasympathetic division. All right. Now you have all these rules, and what I want to point out now is some of the exceptions. When you look at, and by the way, let me tell you something. This table I'm showing you, you can use on the test. I mean, this table is broken up into different slides, but it'll be one full table on a page, and I will print it out for you, and you can use it on the test. Don't get complacent. You must be able to read the table. You have to understand the table. So let's talk about it. Well, under the sympathetic effects, first of all, we are really only talking about the postganglionic fiber. And under the parasympathetic effects, we are really only talking about the postganglionic fiber, because the preganglionic fibers sympathetically and parasympathetically are the same. When I say they're the same, I mean they release acetylcholine, both of them, and the acetylcholine binds nicotinic receptors, both of them. So we're talking about the differences in the two systems, and that's from the postganglionic fiber. Sympathetically, you would expect all the receptors to be alpha or beta, like this, alpha or beta. You'd expect that, alpha or beta, because you expect the postganglionic fibers of the sympathetic nervous system to secrete norepinephrine or epinephrine, and really primarily norepinephrine. And you would expect that norepinephrine to bind alpha or beta. Parasympathetically, you would expect all the receptors to be muscarinic, because parasympathetically, the postganglionic fiber secretes acetylcholine and it binds the muscarinic receptors. Okay, now that's the rule of thumb. Let's look for some exceptions. Look at sweat glands. Look at that. Some sympathetic postganglionic fibers secrete acetylcholine, which binds cholinergic receptors on your sweat glands. Now, not all sweat glands. In the palms of your hands and soles of your feet, the postganglionic fibers secrete norepinephrine, which binds alpha-1 receptors. By the way, when you see alpha-1, that should tell you norepinephrine, because norepinephrine is an adrenergic neurotransmitter, and alpha and beta are adrenergic receptors. When you see cholinergic, that should tell you acetylcholine. And that's what I mean by you must be able to read this table. All right, so sweat glands, the sympathetic division sometimes secretes postganglionic fibers, sometimes secrete acetylcholine, and the example is in sweat glands, and that acetylcholine binds cholinergic receptors. and turns on the sweat glands. All right. Let's go down through and look. And then let's just read one that's not an exception. Now, this is the blood vessels. What does the sympathetic division do to the blood vessels in the heart? Now, this is blood vessel in the hearts. Well, first of all, the adrenergic neurotransmitter binds, if it binds beta 2 receptors. Now remember, the 2s are usually inhibitory. The 1s are usually excitatory. If the adrenergic receptor binds beta 2 receptors, it dilates the blood vessels. If it binds alpha 1 or alpha 2 receptors, it constricts the blood vessels. So it depends on which receptors it binds. That's what it depends on. What does the parasympathetic division do to the blood vessels in the heart? Nothing. Parasympathetic. Now, the parasympathetic goes to the heart. I'm not saying it doesn't. It absolutely goes to the heart. But what does it do to the blood vessels in the heart? Nothing. The parasympathetic division doesn't hit the blood vessels in the heart. Does the parasympathetic division hit the heart? Absolutely. Here's the heart. This is not the blood vessels of the heart. This is the heart. What does the sympathetic division do to the heart? Increases force of contraction and rate of contraction. How? Norepinephrine binds alpha 1 receptors and beta 1 receptors. What would a beta blocker do to the heart? Slow it down. Slow down heart rate. Why? Because you'd block this beta receptor. What does the parasympathetic division do to the heart? Decreases blood pressure and heart rate. So you can see that I can look at this dual innervation. By the way, is dual innervation absolute? No. Sometimes the parasympathetic division doesn't innervate a region that the sympathetic division innervates. Not innervated. So there is a lot of dual innervation, like here in the heart, but in the blood vessels, no, there's not. Okay, moving down. Let's see if there's anything else I want to tell you about. Look at this. This should make sense to you. The sympathetic division is fight or flight, and the parasympathetic division is rest and digest. Now, if you're running from the saber-toothed tiger, you want the glucose in your blood because you want to be able to have it go to the brain, and the brain use that glucose so you think sharply. All right, you need your energy resources. All right. So what does the sympathetic division do? It decreases insulin secretion. So now that glucose can go to your brain and you can stay sharp and conscious and thinking. But when you're resting and digesting, what does the parasympathetic division do to your beta cells of the islets of Langerhans? Increases insulin secretion when you're resting and digesting. So you can see that. All right, let's move on. Is there any other exceptions here I want to tell you about? No, there's nothing here I immediately want to talk about. Okay, so you can read these and you want to look at it and you want to say, okay, what does the autonomic nervous system do to my respiratory passageways, my airways? Well, you increase the airway diameter sympathetically. Think about it. You need to get more air into your lungs when you're running from the saber-toothed tiger. You better relax those smooth muscles in your air passageways and dilate your trachea and bronchial diameters. Dilate them. How do you do it? Norepinephrine binds beta 2 receptors. Okay. What about when you're resting? You decrease the airway diameter. How do you do it? Acetylcholine binds muscarinic receptors, and you contract the smooth muscles around your trachea and bronchioles, and you decrease the airway diameter. So you can see what these things do to the respiratory system. You gotta be able to read this chart. Look at this. This is a little strange to you. You wouldn't think the sympathetic division had anything to do with the salivary glands because saliva is a digestive secretion. However, sympathetically, the sympathetic nervous system does hit your salivary glands. And norepinephrine binds alpha 1 and beta 1 receptors, and it causes the secretion of a viscous saliva. A viscous saliva. Whereas parasympathetically, you get a copious watery secretion with high enzymes. It's rich in enzymes like salivary amylase and salivary lipase. So the parasympathetic division hits your salivary glands and causes you to secrete a copious amount of high enzymatic watery saliva. This helps you digest. But the sympathetic nervous system causes you to secrete a viscous saliva. This is why uh, your mouth dries out when you're nervous, because your saliva is viscous. Your mouth dries out when you're nervous. Now, this is really not different than the animals in the animal kingdom that bite and secrete poison. Because the viscous saliva that we secrete sympathetically, that has mucins and some enzymes in them, would be, if we had poison in them, that's what would be secreted sympathetically from us. This special saliva that has mucins and enzymes. Of course, we don't have poison in our saliva. I can't bite you and inject you with some neurotoxin that kills you. But when I'm scared or fighting, I certainly do secrete a saliva that has mucins and enzymes in it. Whereas when I'm relaxed and eating, I secrete a copious amount of watery saliva with salivary amylase and salivary lipase, the enzymes that do digestion. So you can see that there. All right. That's about it for looking at that chart. You'll be able to use this chart on the next test. Let's talk about some pharmaceuticals that affect the autonomic nervous system. Two big ones. Atropine is used in the military to protect you against chemical warfare. We actually have, when I say we, I mean military personnel have atropine syrettes, atropine needles that they can inject themselves with atropine. What is atropine? First of all, it's an anticholinergic. That means it's anti-acetylcholine. Now that means one of two things. Either inhibits acetylcholine from being secreted, or it blocks the receptors that acetylcholine binds to. How does atropine work? It blocks muscarinic receptors. So what's going to happen is parasympathetically, you're going to secrete acetylcholine from your postganglionic neuron. But that acetylcholine is not going to bind the muscarinic receptors in the effector gland or organ. So you're going to reduce the parasympathetic effects. Whereas the chemical warfare agent that has been sprayed at you or released at you is going to enhance those parasympathetic effects. So how do you combat the chemical warfare? Block the muscarinic receptors. Inject yourself with atropine and block the muscarinic receptors. All right. Look what else atropine is used for. It's used to prevent salivation during surgery. Because the parasympathetic division of the nervous system, of the autonomic nervous system, goes down your salivary glands and says, hey, secrete copious amounts of saliva. Well, what if and by the way, let's go back. Look at this. We just talked about this. Parasympathetically, you say, hey, make a lot of saliva. But what if I block these muscarinic receptors? I don't make copious amounts of saliva. So during surgery, I can give atropine to prevent salivation. I can give atropine to dilate the pupils. Okay, how does that work? Let's go look at the eye. Let's go back and look at the eye here. Did I miss it? Sweat skin, adrenal. Okay, it's right here. No, well, I was going to say, no, it's not there. Wow, I missed it. I was going to say it was right here, because the pupil of the eye is actually, there's two muscles in the iris of the eye. There's pupillary dilators, and there's, okay, let me see. I'm going to say this wrong without thinking about it first. There's circular muscles and there's radial muscles. This is the pupil of your eye. And when these circular muscles contract, you constrict your pupil. When these radial muscles contract, you dilate your pupil. Your pupil is actually made of two different muscle layers. So I don't find it in your list here. But what I was going to say to you was the parasympathetic nervous system causes your pupillary constrictor muscle to contract and you constrict your pupil. The sympathetic nervous system causes your pupillary dilator muscles to contract, these radial muscles to contract, and you dilate your pupil. So what happens if you inhibit these pupillary constrictor muscles, the circular muscle? You dilate your pupil. You inhibit them and your pupil dilates. I really thought it was in your list here. I didn't see it. I don't know if I just missed it. I'm looking again. Oh, right here. Okay. I missed it. It's right here. All right. So what does the parasympathetic division do to the pupil of your eye? It constricts it. What happens when you inhibit the pupillary constrictor muscles? You dilate. What does the sympathetic nervous system do to the pupil of your eye? It dilates it. Think about this. You want to dilate your pupil so you can see that saber-toothed tiger a long ways away. So you can see that there. All right, so let's get back to here. You can use atropine for, military uses atropine. You can use atropine for surgery. You can use atropine medically to dilate the pupils. You can use atropine for oh, I just lost my train of thought. Next, we'll do neostigmine. Here's neostigmine right here. This is anticholinergic. Well, no, this is not anticholinergic. This is parasympathomimetic. Parasympathomimetic. Now, what that means is it enhances the parasympathetic nervous system. All right, it enhances it. So how do I enhance the parasympathetic nervous system with neostigmine? Neostigmine enhances the parasympathetic nervous system in this way. It inhibits acetylcholinesterase. Now, what happens is you secrete acetylcholine here, and you have an effector gland or organ, and that acetylcholine binds an acetylcholine receptor, which happens to be a muscarinic receptor. Muscarinic, okay? So this acetylcholine binds that, and you have an effect, all right? Now, how does this acetylcholine get cleared from the synapse? It's broken down by acetylcholinesterase. But what happens if I inhibit acetylcholinesterase? And the answer is if I inhibit acetylcholinesterase, then I increase the amount of acetylcholine in my synapse. And that's what neostigmine does. It increases the amount of acetylcholine in my synapse. All right. Here's some other drugs. This is a table for you for some drugs. Look at parasympathomimetic. It enhances the parasympathetic nervous system, parasympathomimetic. All right. Make sure you know that word. It mimics acetylcholine or enhances. Because, you don't actually have to mimic acetylcholine. You can inhibit acetylcholinesterase and still be parasympathomimetic. And here are some acetylcholinesterase inhibitors, neostigmine. All right, here are some pathomimetic agents. They mimic the sympathetic nervous system. Here's some patholytic agents. They decrease the sympathetic nervous system. Like beta blockers, propranolol is a beta blocker. That's what that is. All right. So these are some classes of drugs used. And that's it.